Hello, my name's Bobbie Farsides and I'm Professor of Clinical and Biomedical Ethics at Brighton and Sussex Medical School, which is a partnership between the Universities of Sussex and Brighton in the south of England. I'd like to talk to you a little bit today about some work that I've been involved in over a number of years and which has become a very exciting collaboration between myself and colleagues at BSMS and the wider universities. And that is the work around something we've chosen to call rapid ethical appraisal. The rapid ethical appraisal project really began when I was working at King's College in London in the Centre of Medical Law and Ethics, and I was approached by Susie Bull, who had been working at the Nuffield Council on bioethics. Whilst at the Nuffield Council, Susie had been the main member of the team working on their report on research ethics in the developing world. And she'd become very interested in the area and very committed to trying to extend and build upon the experience that she had had. We had a number of discussions about how to approach this PhD topic. There was an enormous amount of guidance coming out from international bodies and collaborations on how researchers should work in a developing world setting, and of course the Nuffield themselves had come out with some quite clear recommendations. So whilst we wouldn't say that that side of things was sorted, we needed to find an angle that could offer something new and hopefully useful to the debate. Susie had already negotiated her way into the MRC Research Centre in the Gambia, a very well established research setting where local people had over a period of years been engaged in a range of projects, particularly around the issue of TB. And it was decided that we would use as a case study for our own thoughts and ideas and conceptual frameworks around research ethics, the work that was currently going on there around both TB vaccinations and a study into the contacts that took place between family members where somebody was affected by TB, to understand better how to advise households to cut the risk of infection. So two very different projects, one really at the cutting edge of science and the other a much more everyday public health style intervention. And what we really wanted to know was whether these projects were in any way affected by this very high level guidance that we had come to know a lot about and understand the intricacies of. And if so, in what way the scientists, who were those most likely to know what was going on at an international level, how they translated what they were told to do and not to do into something that could be taken into the field by the people who worked directly with research participants. We pretty soon came to realise that actually the focus of our project was going to be very different to the work that Susie had previously conducted at the Nuffield. We were in a sense going to hone in on the local experience. We became particularly interested in the role of field workers, who were usually the people that went into community settings, informed people of the research that the MRC was conducting, gave them the basic information, invited them to volunteer to participate, and then if there was interest, actually managed the relationship between participants and the MRC scientists and clinicians from then on. How were these individuals translating the demands for informed consent, full information, voluntary nature of participation, anonymity, confidentiality, all the ethical concepts that were very familiar to us in our own research setting and which were embedded in the various pieces of guidance that were going around at the time. Well, I think we became convinced pretty soon that in order to understand this translation of the global down to the local, we had to observe what was happening, and we had to talk to people about their experience, both of recruiting participants to trials, but also of being participants in these trials, or being potential participants in these trials, being key stakeholders in communities that might be approached to be part of a particular project. And this is where we started to have our ideas around the idea of a rapid ethical appraisal. Now, there's a long tradition of anthropologists and other social scientists going to countries other than their own and observing what happens, coming to understand the cultural norms, the ways in which people behave over important issues, the ways in which people conceptualize concepts such as the family or kinship. But we knew that we couldn't prescribe a social anthropologist to a research scientist, but we might be able to think of some of the skills and some of the types of knowledge that these very expert practitioners could collect given a significant length of time, and see if there was a way in which we could send a range of individuals into a research setting to establish what it was really like, what mattered to people, what their concerns were, what their pre-existing views on the research team that were going to come into that community might be like. As I said before, in the case of the Gambia, the MRC had been present for a long time, and we discovered that people had quite fixed and not always accurate views of their purpose and role. So were we going to be able to convince researchers that there was a place for preceding their research by some good, quick, and hopefully feasible social scientific research into the research setting? Well, traditionally, I would say that scientists are cautious about ethical appraisal, ethical governance in general, and it's not uncommon for somebody to characterize ethics as an obstacle to be got through, or something that might act as an impediment to the work that they wish to do. Susie and I were absolutely clear that good scientific research in a developing world setting had to be ethically robust. But we were also clear that there needn't be this sense of ethics acting as an impediment to good research taking place. Indeed, we came to believe very soon that if you did understand the potential ethical issues that might arise in a particular setting due to the specific piece of work you were attempting to do, understanding and addressing those up front might actually make it easier for you to recruit in the community, and might actually make it more likely that people would stick with the project and you would collect the data that you needed to collect. So, in a sense, when talking to the scientists about this idea of rapid ethical appraisal, we were able to say not only that we felt we could help them meet the expectations of those who are drafting the international and national guidance on ethical governance, we might also be able to help them more effectively reach their own personal goals of achieving the scientific project that they had set out to achieve. So during Susie's PhD, she spent quite a bit of time in the Gambia observing the work, the day-to-day work of the field workers, looking at how they sought to educate populations, how they sought to engage them with the ideas of the scientists working at that time. She also looked at how people experienced coming to the MRC to take part in projects, or how they experienced researchers from the MRC coming to their homes to assess the sorts of things that they were looking at within the TB Contact project. But we deliberately tried not to become quasi-social anthropologists. We knew that if this was going to become a practical tool that could be offered to others, it had to be a contained exercise. And so we hit upon the idea of a maximum of 6 weeks spent looking at the specifics of a particular project. And Susie came out with a fabulous PhD thesis at the end of this, but also she and I came out with the commitment that this wasn't going to be a PhD thesis that just sat on a shelf. Something else must happen. And after her PhD, Susie successfully secured a job at the Ethox Centre in Oxford, working with Professor Mike Parker. And she has subsequently had the opportunity to introduce the idea of rapid ethical appraisal in the context of their many collaborations with overseas partners, particularly within the context of the Malaria Gen project. I too was on the move. I came to BSMS and discovered very quickly that there was a real and growing interest in global health issues here, both with my colleague Professor Melanie Newport, and slightly later we were joined by Dr. Gail Davey, who had spent the previous 10 years in Ethiopia. We had many interesting discussions about the role of ethics in the very complex work that they did around the genetics of podoconiosis, a neglected tropical disease that they were currently working on. And it wasn't long before an opportunity arose for us to try the rapid ethical appraisal approach within the context of their work. I don't want to go into the details of that here, because I would always hope that the people involved would want and take the opportunity to talk about it. But I would like to say that we were very grateful to the openness of the researcher on a Wellcome Trust project looking at the genetics of podoconiosis, Dr. Fasil Tokola, who, despite having no formal training in ethnographic and observational work, took on the task of a rapid ethical appraisal in Ethiopia prior to commencing his own scientific work on the project. And this showed us that actually it might be possible to recruit from within a scientific team to do the work that would be needed to say, yes, we've really carefully assessed the ethical environment into which we're going, and now these are the messages that we need to transmit and the information that we need to take into account when designing our research interventions and tools and ensuring that our participants are treated appropriately. We continue to engage and hopefully develop this notion of rapid ethical appraisal. Dr. Tokola's work taught us, for example, that issues of stigmatization could really be brought to the fore by looking carefully at what was happening prior to your interventions around a particular disease. And of course, this would then have follow-on implications for how you thought about confidentiality or the treatment of research participants within the community setting, the implications of giving people diagnoses and making those in any sense public through the treatment options that they would be then seen to be given. We're currently working with another Ethiopian colleague, Dr. Adamu Adasi, who is taking the project even further to think, right, we're beginning to really collect together the evidence that this works for individual scientists or scientific teams. How might societies, major stakeholders, research institutes, research governance, authorities, health departments think about this? And do we have the possibility of convincing people who are attracting a lot of research from outside their own country to incorporate rapid ethical appraisal in the work that others are given permission to conduct within their country? So it's an ongoing project. It had a relatively small beginning, but it's growing. Interest is always there. We've been challenged from time to time to think about renaming it Rapid Ethical Appraisal. People sometimes don't like the rapid bit, but we've got to remember that we have to, in a sense, sell this approach to busy scientists whose core role is always going to be to conduct the research that they have been set to do. We want to make it easy for them to do that within a sound ethical framework. We also want to make it easy for them not just to do the right thing, but to collect the data, achieve the goals that they wish to achieve. And we think by committing time at the beginning of a project to going into a community, to understanding the role of the scientists, the scientific bodies, the field workers, the chief, the place of women in the society, the attitudes that people have to health, to disease, to illness, the ideas that people have around bodily fluids, blood, and these sorts of interventions that we take as so commonplace within a scientific setting. All of this, we feel, enriches a scientific project because it ensures that people understand their responsibility to work within the community that they are recruiting to their project, and not impose upon them a set of ethical standards and principles that might have very little meaning to people at the local level.